Thank you for joining us today, Philip. Could you start by clarifying the distinctions between Fulcrum's reactive, proactive, and value adding services?
Yes, happily. Well, our reactive services are when we go into a care home to react usually to a problem that the care home has identified itself, or more particularly and certainly more urgently when problems have been identified at the care home by either the CQC or the local authority. And we will go in usually at very short notice and help management sort out whatever problem has arisen. And that will often involve liaising with the compliance authorities, the local authority and the CQC, and of course with the management and owners of the home. The proactive services usually accrue from a reactive service, and proactive services can involve seeking to improve the way an existing good care home is carrying out its services and the way it's managed. So that an example of that is we act and have done for 2 years for a small group of care homes in Surrey, which wanted to improve its good rating to outstanding, which it has now done. And now that that's been achieved, we appear on an occasional basis to carry out audits and mock inspections to ensure that the homes will retain their outstanding rating. So far as value added concerned, increasingly that means advising care homes on ways in which they can improve efficiency. And that largely means introducing them to various electronic and software products to improve the way they're managed. So that will cover electronic care plans, particularly medication records, communications with relatives, and communications for residents, particularly. And there's ways in which those can be greatly increased by helping homes with Zoom, things called a service called Interactive Me, and similar type software programs.
And how have you supported care homes over the last very challenging 12 months?
Well, of course, the pandemic has been overwhelming for the care industry as a whole, and most particularly for care homes. And whilst some of the criticism of care homes is justified, I'm not sure that all of it is, not least because of the muddled advice that came out at an early stage from the government. Having said that, our services directly related to the pandemic early last year were focused on providing advice on infection prevention and control. And we issued guidelines to the care homes we were advising in advance of those prepared by the CQC. Since then, we've sought to strengthen the IPC practices within care homes. And increasingly, we're helping care homes with advice on how they can increase their low or relatively low occupancy caused as a result of COVID and the pandemic.
And as part of your services, you offer free interactive online dashboards with real-time CQC data. And what do these tell us about how the CQC has responded to the pandemic?
Well, yes, there is a service that's available on our website, which is fulcrum.care. Well, that's www.fulcrum.care. And the dashboard is provided with real-time data directly from the CQC. And it contains details of the number of care homes in the country divided up by region, the number of those care homes that have the 4 ratings of outstanding, good, inadequate, and requires improvement. In addition, there is information about how many beds are in the care homes, in what ranges, and what that shows as a result of the pandemic is, first of all, that far fewer CQC inspections were carried out since March last year than in the previous year, something like a quarter. And it shows also that of those inspections that were carried out, the number of homes that were found to be inadequate or requiring improvement has considerably increased as a percentage of the of the examination of the inspections actually carried out. But it is available. It's available on that website, www.fulcrum.care, and it is free to use for anybody to log in and find out that information.
Have you seen rising demand for your services as a result of the growing number of homes having rating downgrades and receiving?
Yes, very considerably. We've or at least our consultants have worked extremely hard over the last 12 months. Some of that has been generated by COVID, and I've explained how that started off. But increasingly, we are helping homes how can I put, restore themselves from the effects of COVID, which in financial terms, of course, means significantly reduced occupancy. I think last year I read a statistic that the average drop in of levels of occupancy were 20% down on what they were a year before. That's now improved, but it's still high 80s, about 90% and not much more. So we're increasingly assisting with the commercial aspects of running a care home. And we're also finding that we're being asked to carry out audits of care homes for funders. So that's private equity houses and banks.
Are you recruiting in order to meet this higher demand yourselves?
Yes, well, because of the increased work that we're doing at Fulcrum, we very much want to recruit experienced and high quality consultants who have a degree of flexibility about the way they will work. That is to say, they're prepared to travel around the country, not on a consistent basis, but who are prepared to go into a care home to sort out a problem if it arises quickly. So that might be a day or two away, and who are also prepared to retain an interest in a particular care home or group, so that there's a degree of consistency with the advice and guidance that the care home is provided with by Fulcrum. We're looking especially for people who have care home experience behind them and who know what I call the CQC regulations and the regulations issued under the Health and Social Care Act of 2008. And that would also include, of course, ex or retiring or leaving CQC inspectors themselves. We would be especially keen to see. So anybody who's interested, please get in touch with Fulcrum.
And looking ahead, Philip, what are the key challenges facing care home professionals over the next 2 years?
Well, we believe that one of the things that has undoubtedly affected care homes is clearly COVID. And so we believe that will continue to be a very important issue for care homes, particularly on the infection prevention and control issue and on PPP, and ensuring that COVID doesn't again seep into care homes the way it did early last year. So keeping on top of infection prevention and making sure that staff and visitors are regularly tested and use PPP properly is absolutely paramount. Over and above that, we believe that one of the things that care homes will need to concentrate on is building up their occupancy rates again, and to a lesser extent, making sure that their assets are properly maintained. I suspect a lot of that has not happened over the past year for obvious reasons, but it is important for care homes to keep the quality of their accommodation up to scratch for the benefit of the residents and indeed for their own commercial best interests.
And what key steps should care home professionals be taking to manage these challenges successfully?
Well, we talk about this issue as being something related to what we call the 3 C's. The first one is compliance, and I've just talked about that in relation to infection prevention and PPE. But it is vital that care homes should, of course, maintain compliance with all the CQC regulations, that they should keep proper records of the care they give to their residents, the state of the home, the medications they dispense, and so on and so forth. That's absolutely vital. And once that is under the belt, then it's much easier for a care home to be confident that it will get at least a good, if not an outstanding rating when the inspection comes along. And it will then also improve the second of our 3 C's, which we call confidence. We believe that owners, some owners at any rate, have lost confidence in their care home as a result of COVID. And we believe that it's very important for them to exude, I would say, controlled confidence about their home. For example, when people go into a home to see it, it's very important that they receive a warm but professional welcome on the, as soon as they step over the doorstep, certainly by the receptionist and whoever takes them around the home. It's important that the home looks good, smells good, there are fresh flowers around, things of that nature. That's what we call confidence in the care home, and that of course spreads out also into the promotional activities that the care home undertakes. The third C for us is commercials. And again, we've touched on that. It's always obviously important that the financial viability of a home is sound, and that's primarily for the benefit of the residents. Secondarily, I suppose, for the benefit of the owners. But again, it's an area where there has been a lot of pressure for some homes over the past year, and it is an area in which Fulcrum can help with issues like, for example, how to control agency costs, because that's always very high. How to improve prices for utilities and supplies and things of that nature. We can also help with HR matters and things like staffing levels and issues of that nature. So those are the 3 primary issues which we think care homes should concentrate on over the next year. And just to repeat it, it's compliance, confidence, and commercials.
That's great. Thanks for that. How should care homes ensure their investments in technology deliver better care outcomes and commercial success?
Well, we've touched on this before, and it's my own experience with a care home is that when you try to introduce technology into a care home, there can be a lot of resistance from the management and staff. And I tried that with care plans, and eventually we got there with Fulcrum's help. But there was a lot of resistance to moving across to an electronic platform away from written documentation. So the first thing to do when introducing technology is to make quite sure that the management and owners of the care home know what they want the new technology to do. And that's the first element of any advice we give on these issues that we feel is essential. The second recommendation we have in this regard is that a care home should appoint a champion for the introduction of the particular bit of software or new electronic processing that's being introduced. That person, we suggest, should be a senior member of staff, but somebody to whom those staff members who may be not so sure of the new software can talk to and seek help from. And the third essential element is to ensure that any project plan for introducing new technology must allow sufficient time for staff to be fully trained on the new technology. I say that because, certainly again from my own experience, there are a number of staff, quite often those who've been in the care home for a very long time, who are not wholly computer literate, and indeed are a little frightened of embracing computer technology in a work environment. So they need careful training, careful and patient training, I would say. So those are the 3 elements. Make sure management knows what it wants, appoint a champion, and allow sufficient time for training.
And how do you support new investors in the sector, Philip? Are you seeing a lot of new investors looking at care homes?
Well, yes, we are, and we're very pleased to see that, because despite the downturn in business last year, it's good for us and for the sector, and indeed for the country, that there is still significant investor interest in the care homes sector. And we have found over the past few months that increasingly we're being asked by investors to carry out audits on care homes, more on the care side than the financial side, But of course, it's of interest to an investor to know that the care home is being properly run, because if it isn't, then the ultimate risk is it'll be closed down. So yes, is the answer. We're seeing more investment, and regard that as a good thing.
That's great, Philip. I think that's everything. Yeah, so thank you for joining us today and sharing your insights on the sector. It's been really interesting to hear more about Fulcrum Care.
Not at all. Thank you very much, Lee. Thank you.
You.